School Board member discussion session. And we are starting in the Joe N. Idolette Jr. Teacher Education Center. I believe we're finishing here as well. And we have Dr. Moore here today to present with us our discussion items. So, Dr. Moore?
Thank you. Just to set up the confines of the day, this is a condensed workshop, only 2 hours in length. But nonetheless, we do have a number of healthy agenda items. One is the review of the Progress SDRC and our Safer at Schools plan. That was an item I placed on the agenda because two board members placed it on for this evening, whether it be action or discussion. And I thought it was a good time to maximize this time to really have a dialogue and conversation about the creation of what that plan would be. Then the much anticipated Code of Student Conduct. It says here Ms. Dampier, but Dr. Packard is here in the absence of Ms. Dampier, who is returning to us soon in good health, and we're excited about that. And then the final option presentation will be the strategic plan Q3 update, as well as the update on the joint plan and where we are, referencing the 53 recommendations. That was a conversation that took place during the one of the first joint meetings. So the first item is the face coverings, and I will set this up briefly, then turn it over to board members for any input or support that you may like to provide. And I think that the premise of this conversation is if you fail to plan, you plan to fail. And this is an opportunity for us to engage in conversation and dialogue regarding the steps to return to normal. And taking the steps in a very respectful, taking the steps in a very open and honest process to ensure that we as a district uphold the commitments that we have made, while at the same time going through the exploration to determine conditions as to when we could, in a safe, respectable way, begin to unmask children. This is not a conversation in my mind regarding the remainder of this particular school year. I think we are in a place implementing a plan that has provided a great deal of flexibility, and our principals and teachers should be commended in the implementation of that plan over the course of this year. There are 32 days of school remaining. Just last Saturday, the health department, or in partnership with the health department, we went through our last offering of, I guess, all call of any district staff or employee who wanted to participate in the vaccination process. That process for those individuals would be completed going into the last week of school. So we need to allow that to happen. As we look at summer school, we feel with the current plan in place, there are a number of accommodations that we can make to maximize a mask-free space because of the size of schools and the number of kids and the ratios that are there. A lot more flexibility when you have less people in our very, very big buildings, which gives us additional opportunities to reorganize, use larger spaces with smaller numbers of students and ratios to maximize opportunities to take a mask break if students feel the need or educators feel the need. And then really determining what needs to be present to move forward for the opening of school years, opening of next school year. What changes or modifications are being presented by the CDC? What is the feedback and review of our plan by our health department? Reviewing with our local pediatricians the parameters that are in place, the availability of vaccination for school-age children, where that would be. Make no mistakes about it, I want to move to a mask-free environment, but I want to do so, as do all of you, in a space and in a time and with a plan that ensures we are sound in our decision-making. We have not jeopardized the environment or the health of anyone in our particular schools, and that we give enough time, which I think this is the right time to begin the conversation, to inform our families as to what the 21-22 school year would look like. It is a commitment that we all should make to be respectful, honest, because the truth of the reality is there are varying viewpoints on what is the right way to move forward. And it is not an easy decision for me or an easy decision for board members. So as we move through this process over the next several months, it is engaging in the dialogue and being nimble enough to make the right decision with as much information as we have available. So the item that Ms. Barenboer presented is very, very straightforward. I think it is appropriate in terms of that. I would ask for consideration to move the date to provide the plan back maybe into July. And I ask for that simply because we need as much time as possible to ensure that we're making a plan that's in place to be as accurate as possible, given the amount of time and how quick shifts and changes take place, so if that can be a consideration. That's just to set up the conversation, the dialogue, so I'll turn it back over to the Vice Chair because she is the maker of the item.
Thank you. Yeah, I obviously have a lot of thoughts on this, having done some homework. But I will reserve my comments to the end since I'm running the meeting. Who would like to speak first?
I would.
Okay.
Thank you, Dr. Moore, and a special thank you to our staff and students in doing a really good job this school year. As most people would say, it's very hard to wear a mask, but you know, when I look at our bylaws and policies, and one of our bylaws states that the ultimate responsibility for public education in Indian River County rests with the board. And to me, that means a safe education. Now, safe, when I was a principal, was a little bit different connotation. I became a principal 6 months before Columbine. So that changed my perspective as a parent and as a principal. And now we're at war with an enemy we cannot see with this virus. I agree with you on not making anything happen these last 32 days. I think we do need a plan, and if summer school can work where we have the 6 feet, I mean, I think each school, each principal could determine that, and a plan is good. But once we do this plan and we open it up to mask optional, it'll be very hard to take back if other things happen, or if we have more situations in the summer, or we have more, our cases are rising in Indian River County. So I would, just be cautious in our plan, knowing that our ultimate responsibility is the safety of our students and staff. Thank you.
Ms. Rosario? You wanna speak?
Would you like to go first? I personally am in favor of going to optional masks. That is not a secret. I put this item on as a discussion for this evening quite a while ago. Our conversations have evolved since I put it on the agenda a while ago, and so we are where we are now. However, I don't get to make the decisions on my own, obviously. My decision, my thoughts, and my views are just that, they are mine. And I realize that as a board member, we are to make decisions collectively together. And so I called up several pediatricians. I called up several pediatric dentists. I called up some principals, and I just kind of picked their brain, asked them questions about their opinions on masks, and obviously with regard to children in school. And quite honestly, everyone was just, had mixed feelings, everyone. There wasn't one opinion that weighed more than another. Some pediatricians said if it was up to me, I would have no masks. A dentist said the same thing. If it was up to me, I would have no masks. They do not, in his practice, he had not seen anyone come in with any mouth, gum disease or mouth issues because of the mask. because in his opinion, as were with the pediatricians, the masks are worn during the day, and predominantly when they go home, they're not wearing masks at home. But then I had the other part, that said, it's just safe, it's smart for us to keep the masks on. Essentially, why not? We are at a time where our numbers are low countywide, and here in the district, I calculated based on the numbers that that Kristen sent us, that Ms. Maddox sent us. Since February 25th, I counted, and my count may be off 1 or 2, but I counted 23 students who were positive cases for COVID, and 107 students quarantined since February 25th. That's a lot. That's a huge difference. I understand that there are certain limitations that we have because we have opted to, and I don't even know if opted is the right word, to collaborate with the health department, the local health department, the CDC's recommendations. And by the way, the CDC does not demand or command or tell us what to do. What they have on their websites are simply just recommendations, and it is up to us locally to make the decisions from there. And obviously, every district is different, every county is different in their numbers and in their cases. So with that said, we are working closely with the health department. We have been doing that since the beginning of the year to ensure that we are doing contact tracing the right way, and thus the quarantine. I can sit here probably for another hour and share the very many opinions that have come in on on both sides. The bottom line, though, is as succinctly as I can make it, we are ending the year. We have several weeks left. We do have testing coming up, and I think that testing is a critical factor in this equation that I think that we ought to pay very close attention to. The question then becomes, if we were to continue with masks for the rest of this school year, even if we weren't, what are we doing about the quarantine situation, especially during testing? Do we quarantine those who have come in contact, or do we not? And that, to me, is a bigger concern at this point, because I don't want any students to be hurt because of the whole quarantine thing. I reached out to North County Charter School in our community to speak with the principal. I have not had a chance to speak with him directly. North County Charter is the only school that I am aware of that does not have a mask policy. They have not had a mask policy since the beginning of the year. It is my understanding, based on feedback from staff members and from parents there, that their numbers for COVID have been near zero. I don't want to say zero, but very, very, very low. So then I started to wonder, and I wanted to ask, and again, unless I hear back before this evening, I'll let you know. If that is the case and they do not have a mask policy, or they're not enforcing the mask policy, if masks are optional in their school either way, and if they are not reporting, not saying that they are, but if they are not reporting to the health department, then they're not quarantining. The assumption, the fair assumption would be that they're not quarantining. And if they're not quarantining, then where is the health department within that factor? Now, I don't have those answers there. I don't know who does, and it's not for us to debate. My point is that if it is possible for some, then it could be possible for us. For the rest of this school year, I would like to ask that we not quarantine. I would like to go to optional masks. If we don't, I would like for us to stop the quarantining. One of the schools in our district has reduced their number of quarantining students from the beginning of the year, working with the health department. I'm going to say it's Imagine School. They purchased, and I forget exactly how much he said. I don't know if he said tens or hundreds of thousands of units or dollars worth, and I'm not sure which, of desk guards. I've been talking about desk guards for a long time. So what they worked out was a plan to desk guard the students who would have been quarantined. So instead of being quarantined at home, you're quarantined to this particular area with your mask and the desk guard, and you are in class. I personally think that's a stretch, but it worked for them. So their numbers for quarantining have not been as high. And from what I understand, the health department said that their plan to do this has been one to be modeled after. So where am I going with this? I'm going to ask that I haven't even heard what Terry has to say, but I would like for for Dr. Moore and his team to take a closer look at our Safer Schools plan, our plan that we unveiled in August, page by page, line by line. There are new guidelines that have come out recommended by the CDC, much of which has gone from 6 feet to 3 feet, which we should know, and that the definition of how we contact trace should be, if we're saying you've been in contact with this person for 5 or 10 minutes, and so therefore all of you are quarantining. I'm not sure that we're doing that, but I think that that might make a big difference. However, I would like us to stop the quarantining. I would like us to go to optional masks if possible. If we cannot do that district-wide, overwhelmingly the majority of the people who I have spoken with, professionals in this area, said at a minimum with elementary school students. Elementary school students could go optional. Middle and high school, probably not. The majority highly recommend that middle and high school remain masked. I'd like us to take a look at the role that the community plays in this decision-making process. I don't want us to keep adding on more things to do, and then therefore, by the time we make our decision, it's the end of the year, and so we've just wasted all this time. But I do think that a new look on parent and teacher feedback would be very key to the decision that we make as well. So many people have been vaccinated, and so our employees who have been vaccinated and parents who have been vaccinated, they may feel different than they did in August. And so their role and their feedback would be critical, I think, for our decision moving forward as well. The quarantine thing is my biggest concern at this point. If we are going to have regular graduation ceremony and prom, are we mandating masks for those, Dr. Moore? I don't know.
Through the chair, that we are offering, school system is open, those events will take place, graduation, prom. Our high school principals, along with all of our other principals, have done a absolutely outstanding job of adhering to our current Safer at School plan and providing those opportunities. They've engaged with students to create those experiences, so everyone's looking forward to having the proms at the two schools that high schools that we supervise. Mm-hmm. Graduation also will take place, and once again, based on the size, we're very, very excited to create a space that will allow students to follow the Safer at School and pretty much have the option of wearing a mask. There may be opportunities as you walk in, but to create a space where you can get your picture and all that, we think there's some things that we can do using glass dividers and such
Right.
to provide those opportunities for students to be as close to normal as possible.
Okay. So with that in mind, for everything else that we do, I'd like us to start to move in that direction as well, to make things as normal as possible, whatever our new normal is. One of those things that I'd like us to do, one of those things that I'd like us to do is to ask the board to go back to the dais. If we are going to set the stage for moving in a new normal, we can ourselves have desk guards up there. We are the ones who are the examples for what we are asking, and so I am willing to do that. I don't know the feedback from board members. And my last thing here is transportation. The one area that I'm not willing and I'd like us to consider not changing are wearing masks on buses, because they are definitely in closer quarters, they're confined more for obvious reasons, at least maybe until the summer or the fall. And I think I will leave it there.
Dr. Shea?
Well, a lot's been said. I guess first and foremost, I will acknowledge that I, as a human being, am risk averse. In being risk averse, I believe we go for the strategy, I don't want to take risks. I don't want to take risks with illness. I feel incredibly blessed that I have gotten through the last year without having gotten sick. I am unbelievably grateful for that. That's not true of a lot of people I know. I know people who are suffering severe, deteriorating long-term consequences. It's called long COVID. People who are now on heart medication, people who have lung problems, people who are not back to work. We have done an exceptionally good job in this district of keeping our schools open. We opened on time. We got kids back to school. We got roughly 60% back to school when we first opened. We're now at roughly, I believe, 85%. We have not had to close a single school. We have not had over, I think it was it 5% of students was our threshold criteria, I believe, correct me if I'm wrong. We have not exceeded that in a single school. I don't believe that that is because we are over-masking or over-quarantining. I believe it is because we are following medical science, and thus we have kept our schools open, and we have had as normal a school year as is possible under the circumstances. So that said, I agree with Dr. Moore in keeping the current safeguards in place until the end of the year. My understanding, but teachers can feel free to correct me on this. My understanding is that that's what teachers want. That's what has teachers feel safe in our buildings. I want to support teachers in that, because if we don't have teachers who feel safe and are able to do their jobs, we diminish everything else in this district. We diminish our academic capacity, our academic achievement, the degree to which students feel safe, and so on. I don't need to repeat all of that. So I agree with Dr. Moore and I believe Dr. Jones in keeping our current standards in place. I agree that we can take a look at those in the summer, given that we are able to distance in ways that have people feel safe. My primary intention is that people feel safe. I don't know how much everybody is paying attention to the news, but for example, Michigan is having a dramatic upsurge in cases right now, having lessened requirements. I'm personally not willing to see that happen in Indian River County. I feel quite strongly about that. Again, I feel incredibly blessed at how well I and most members of my family have done in the last year, and I don't want to take risks with that. I don't want to follow the example of Michigan and some other states where we don't know what's going on. So for that reason, I do believe in pushing back the date, because this changes daily. This changes daily. We don't know what the scenario is. And we've done really, really well this year. I believe I want to keep that trend. I don't want to threaten that trend or dismantle that trend in any way. When we are ready to make a plan, I could be supportive of starting in elementary schools where there really is, there seems to be evidence, and there is a tremendous amount of evidence in many ways out there, that this is not transmitted to great degrees by small children who don't seem to catch the disease as much and whose the trajectory of their breath doesn't go as far as to infect others. And I'm willing to consider that when we're ready to do that. I really agree with Dr. Jones's point that once you go there, you can't take it back. That's something I practice in a lot of areas in my life, also as a parent. I want to err on the side of caution. I don't know what's going on in charters. I can't speak to that. But I do know that making decisions for 500 kids is very different than making decisions for 15,000 kids. And so what you are able to do in a smaller space with limited students is far different than the responsibilities of the district for 15 to 16,000 kids, which comes not only with logistical challenges, but financial challenges, cleaning challenges. How do we clean those guards every night? So I'm not sure that that's a strategy that works for us, given given our capacity, given the magnitude of what we have to deal with. It's on a very different scale than any of our individual charter schools. As to going back to the dais, the only way I'll do that, frankly, is if either there are guards I would consider, but if we're all masked. If you will note, in these meetings, you'll notice I'm backing up to this. The only way I'll wear a mask, not wear a mask, is when nobody is on my right side, and I move farther in that direction. In the evenings, when the room is much more crowded, I'm wearing a mask. I am erring on the side of caution. I believe in doing that. I believe that's what we model for our district. I believe we model what is the safest, what is the most responsible, what is the most risk-averse, and what follows the guidance of our education and medical professionals. So that's where I am with it.
Okay,
Mrs. Berenborg.
my turn. Thank you for all these comments, and it's great to hear that you've called pediatricians and people like that, because I made some phone calls too, but to different people. Just to give a little history on this, back on October 13th, on an action agenda item, I had put a request for a plan to be created. And that request for the plan got delayed due to a lawsuit that was filed on 10/28. So because of that lawsuit, everything got pushed back. I'm a planner. I believe in not doing something erratic. I believe in not doing something that causes chaos. I believe in doing something with well-planned out thoughts. That is why I'm asking for this to be discussed and acted on today, because I'm not looking for an overnight quick. I am looking for, let's plan this out carefully and do the right things and follow the guidelines that we're supposed to follow. That's my request, so that you know. When I put this item together, I went back and forth with the superintendent about it, because I felt like we needed to all consider certain factors, because you all do your homework and we all do separate homework, which is great, because this is the only time we can really talk about our homework. When we originally put masks on kids, it was because of the hospitalization rate. If you remember back when, we were told to mask people because of the hospitalization rate so we can get them down. I checked today, they are down, big time. So that now became something different. It's no longer the hospitalization rates is why everybody's masked. Now we're used to it, now we've discovered other things. So I'm not saying that it's wrong to not follow what we originally said. However, my feeling is, I know for a fact that masks don't work for a personal reason, but I also think that the only reason why a mask would work is if somebody coughs or if they speak loudly, then of course that's going to go farther, and so I understand that. I understand the 6-foot rule, and I understand why somebody would want to be masked. I follow the rules. I mask when I'm not within 6 feet to be kind to my fellow man. And we are 6 feet apart from each other here, so I don't worry about that. The concern I had, is I watched the governor's roundtable, and he had experts on there, immunologists, and pretty high up there experts. And whether or not social media has decided to censor him or not, that's a political issue, and that shouldn't come here. I've had people email me about it and call me about it, and I'm sorry, but he's our governor. He had experts, and he had a panel, and he had a discussion. During the discussion, they talked about how masks are horrible for children, so I called his office. I was up in Tallahassee. I was meeting with different people, and I decided, all right, I'll call his office. So I called the office, and I spoke to an aide, and I said, I watched the roundtable. I'd like to know, are you giving us guidance? Is there going to be an executive directive? Are you telling us as school board members that we should be unmasking children? What are you saying? I wanted it directly from the governor's office. And the answer I got was the same answer I got when I called 6 months ago. And that was, call the DOE. And I said, well, I'm kind of disappointed that you would have a roundtable and talk about, unmasking children, and yet when I call your office, this is what I'm getting. Because I'm going to tell you, and I told the girl, last time I called the DOE, they told me to call or follow CDC guidelines. CDC guidelines say to have children wear a mask. And she said, I know, that's what I have to tell you to do, which I was a little disappointed with. So I called the DOE, and I left a message on Richard Corcoran's voicemail, and didn't get a reply. So I happened to be with some people the next day up in Tallahassee, and was a little frustrated that I hadn't gotten a reply in a week. So they made a phone call, and I got a reply within an hour. Interesting how that works up there. So the interesting conversation that I had was, it's still follow the CDC guidelines. And a lot of it has to do with protecting people and protecting our government and protecting us and protecting society. And it's a little frustrating to be in this circle. And when I asked, well, okay, follow CDC guidelines say to mask children. And he said, yep, I know. That was not Richard Corcoran that told me that, just so you know, for the record. But that is kind of the runaround I got up there. And I'm putting it out there because I think people should understand how frustrating this is. It is not black and white. It is gray. And it's very frustrating. So just when you hear somebody saying, okay, here's a great medical report, can you believe it? Here's, people are sending us stuff left and right. It's amazing, and it's amazing to me that people think if you cut and paste something and send it to you like that, not the entire document, that that's a valid way to send research. Sorry, but it's not. Okay, I'm just putting it out there. That's not the way to do it. Send us accurate reports. Send us things that you feel like we can research, because I do go back and look at that. I understand our laws and policies, Peggy. I do not want to go against those. I'm not asking for that. I am asking for a plan, though. I'm asking for how are we going to, nobody is saying, when will this end? When can we finally unmask children? What are we looking at to do that? Are we looking at numbers, hospitalization rates? Are we looking at vaccines? You mentioned, Dr. Moore, vaccination review of children. Are you referring to having children vaccinated with COVID? With a COVID vaccine?
Right now, it's available to students 16 and above, and they're considering allowing 14 and above.
Yeah, I don't think we should use that as a factor at all. I think that's a parent's right to decide whether or not they vaccinate their child. And so I don't think that's a factor that we should be using, period. I'll stand straight on that one. The prom and graduation, I ran into a parent recently that, first of all, she thanked us tremendously for allowing prom. So I wanted to put that out there. She's very appreciative of their child getting to have prom. Searching for a prom dress around here is hard, so she went to West Palm. She went to West Palm, and when they were searching for prom dresses, the lady said, wait, you want a prom dress? Why do you want a prom dress? They're not having prom. And she said, wait, we are. And she said, what schools? Because none of the schools south of us are having prom. I'm not sure if it's now opened up down there, but this was 2 weeks ago. So she was very appreciative of that. Graduation, I feel like if they are 6 feet apart, sitting outside, you know, these poor kids have had all their pictures taken with a mask on. You know, if I were a parent right now, I'd be frustrated because all my kids' great opportunities of taking their picture has a mask on them. So I would love to see them, and when they're socially distanced with the mask removed, and when they go up on that stage and be able to have their picture taken, make it so that we're away from them so they can have their picture taken without a mask, please. I think that that's important. I think looking at summer school is the time to do it. I don't think right now is the time to upset all the apple cart. We are starting testing today. 3rd graders, correct? Taking
Yes.
reading tests. So the testing session goes from now until basically the end of the school year. So I don't want to upset any apple carts. I know people are frustrated with all this, but if they can see a light at the end of this tunnel, I think that's helpful. But I think if we pull back immediately right now, we're going to have anarchy because we're going to upset the assessment schedule, we're going to upset parents that want masks, we're going to upset a lot of things. So we do need to stair-step this and be careful with it. I did ask for our attorney to send you guys Senate Bill 72 this week, which has now passed into law. The governor signed it. If you'll look at it, it's talking about quarantines. Here's the issue, you know, and Suzanne, is Suzanne here? Oh, there you are. Suzanne, sorry. Could you kind of give it to us in a snippet as to what SB 72 says?
Welcome back, by the way.
Yeah.
Thank you so much. Thank you. It's wonderful to be back. Thank you so much. Yes, now understand that this bill was signed by the governor the end of March, and so it was effective the end of March. Not a lot of guidance has been issued on it, so there may be more information coming, but I'm just going to summarize the portion of the bill that would apply to you. There's a section that applies to healthcare providers, which we are not, so I'll just do the part that it would apply to a local government. That provision of the bill provides that we are eligible to be exempt from civil tort lawsuits arising out of issues that happen because of COVID-19. Civil tort lawsuits. I want to be clear, this is not a get out of jail free card. This applies to civil tort lawsuits. And a great example would be slip, trip, and falls, bus accidents, a fall on a playground. Those are your typical civil litigation lawsuits that would apply to this bill. So if we were faced with a claim by anyone that fell into the category of a civil tort lawsuit arising out of COVID-19 that was somehow caused by COVID-19, if, and there's an if the school board was following the standards and guidance at the time in order to protect people and ourselves from COVID-19, and the court finds that we were following that guidance, then we are exempt from being sued. We have immunity from that suit if we are following the guidance and the court says, yes, you are following the guidance. The bill goes on to say that if you are not, if you are found to not have been following the guidance, the lawsuit will continue. However, if there is a heightened standard of proof, the individual who filed the lawsuit must show by clear and convincing evidence that their damage, their illness, whatever cause of action they may have, by that heightened standard of proof was the cause of this, was the fault of the school board, then the lawsuit will continue on. So if we're following the guidance, there is complete immunity. If we are not following the guidance, the lawsuit continues with a heightened level of proof. So the bill gives us some protection with regard to lawsuits which may come forward in the next year or so with regard to COVID-19.
Thank you.
Of course.
And that guidance and the standards and guidance is the question. So, for example, when I called the governor's office and asked for guidance, I was told to call the DOE, follow CDC, which, again, the standards on the CDC say to mask children.
May I just add one more
Sure.
thing? I'm sorry. There isn't necessarily, a lot of bills or statutes will define terms for you. And so I went searching to see if there was anything in this bill that defined what is that guidance. How do we define what that guidance is? And of course, unfortunately, there's nothing in the bill. But I've not completely listened to all the different conversations, on the floor, committees about this. But what was coming forward in some of that discussion, which is not necessarily going to be definitive, but what was coming forward during those discussions amongst the committee members and on the House and the Senate floor was CDC guidance at the time, Florida Department of Health guidance at the time, and governor executive orders. That was part of the discussion. Didn't make it into the bill, but that gives us some idea of what to perhaps look at for assistance in determining what are the best standards to follow in order to come under this immunity that's provided under the bill.
Okay, thank you. Not that we have to be worried about lawsuits. My concern, number one, is safety of children.
Right.
And so I think, keeping that forefront is number one. Seeking guidance from experts, because I'm not an expert in immunology, is number two. And I think that, when we're looking at something like that, though, it's important to know what's going on up in Tallahassee. So I just wanted to make sure that you understood that part. After school, Dr. Moore, we talked about after school programs. When kids go after school off campus of the school district, I have witnessed it myself. There are no masks on these kids. They are gathering in groups of 50 and 60 kids. I see it all the time. I'm concerned that the health department, and by the way, we don't quarantine children, the health department does. So I am concerned that the health department is only working on the actions of what happens in the school district. And where are they when they're talking about big events outside the school district? How come those events aren't being quarantined? They were at the beginning, and now they're not. Maybe because they're overwhelmed down at the health department, probably. I don't know, but it almost feels like we have to follow certain rules, and the rest of our community is following different rules. And it's unfortunate because, I think we got to do what's best for our kids, but I also think it's time again, and you have surveys out there right now. I didn't get a copy of the parent survey, but I would like it. Maybe other board members would like it, because I think that should be a question in there. Is it?
In the climate survey, no, it's very
Okay.
specific to the actual school climate, but it'll give us a lot of meaningful data as we problem solve over the summer in terms of shifts or modifications.
Because I agree, I think Ms. Rosario brought that up, to have sort of parent and teacher feedback. I think that's important, because now teachers have the opportunity to get the vaccine if they want it. And I know they haven't gotten the second round done. So once that second round is done, then we can assume that the employees that wanted that second vaccination have that vaccination. And so if that's the case, that kind of might give us some different feedback. I don't know. Ms. Rosario, did you want to speak?
Yes, please, thank you. I wanted to ask Suzanne, I sent you an email yesterday. I haven't had a chance to go back about where we are in terms of the health emergency, the state health emergency, and so on. Can you give us an update on that, please?
Absolutely, Mrs. Rosario. The Dr. Rivkes, who is the state surgeon general, he renewed the declaration of public health emergency back in February, and so his declaration of public health emergency expires April 20 of 2021. I don't know what, if anything, he will do closer to that expiration date, but currently we are still under the declaration of public health emergency by the state surgeon general. In addition to that, the Governor DeSantis renewed his state of emergency back in February as well, and that expires April 27 of 2021. So the governor's state of emergency for the entire state of Florida with regard to COVID-19 is still in effect. And again, he's extended this several times, but I have no idea what he might, do closer to the expiration of these orders.
So I think that plays a part, because I did not intend to suggest that we are quarantining, but we are partnering with the health department and providing the information for who are social who are the students who are in close contact. The close contact information, the CDC, the health department would not know who those close contact people are if it weren't for the schools working closely with them, the district working closely with them. But in light of the ongoing emergency orders until the end of April, at least at a minimum, my next question to you legally is, in order for us to ensure that we are not negligent, that we do not fall in any type of negligence to be sued during COVID or as a result of COVID and all of the items that you just mentioned previously, are changes to our plan, if we decide that we want to make any changes to our current Safe at Schools plan, and we decide, whatever those changes might be, and we decide to adhere to a new edited version of our Safe at Schools plan, would that suffice under the state of emergency? Would that suffice still under the health emergency? And because we do not have to follow CDC guidelines, because CDC are just guidelines, to what extent do we have authority under these emergency plans, under these state of emergency and health emergency, to what extent do we have the full authority to make the decisions at the local level and still remain safe from lawsuit, et cetera?
So I'm going to take your second question first. Do you have the authority to make changes to the plan? And my answer is yes.
Yeah.
The school board does have the authority as the governing body of the district to make changes to that plan.
Okay.
With regard to changes, what the bill says, so let's talk about the bill that we just discussed first, then I'll go to the first question. What the bill says is substantially comply with authoritative or controlling government-issued health standards or guidance. So if that's what, as long as we are in compliance with the authoritative or controlling government-issued health standards or guidance, then changes to your plan in compliance with those standards would still allow you to have immunity under the bill, immunity from civil tort lawsuits.
Okay.
If changes to the plan deviate from that, what that means is a lawsuit can be filed, and we would be in the lawsuit. We wouldn't be able to get out at the very beginning. We'd be in the lawsuit, but the individual who sued would have to prove a heightened standard of clear and convincing evidence that what we did caused their injury, their sickness, whatever the issue was that they sued us for. Okay, so it just means we're in the lawsuit with a heightened standard for the plaintiff to prove. With regard to your first question, I don't know what your changes are to the plan, so it's difficult for me to say whether we'll be in compliance with government standards. Without having more detail of what you're looking at doing, because the CDC has lots of recommendations, and the Department of Health has lots of different recommendations, and I'm sure your local Department of Health has lots of different recommendations. Those would be the universe, if you will, of standards or guidance, and how does your plan fit into that, those recommendations. But if you deviate from those recommendations, can you do it? Yes. Does it mean that you could get sued? Yes. Yeah.
So here's why, I apologize for the mix-up of that.
That's
Because
okay.
I was actually asking as I was thinking at the same time, kind of walking it through in my head, what am I supposed to say here? Because I know what I wanted to ask, but it just didn't come out as clear as I thought. But I appreciate, thank you, you're good at what you do. one of the reasons why I'm asking that specifically is because our plan identifies social distancing as being 6 feet apart. The CDC's revised guidelines recommend 3 feet apart. If we were to change our current plan to 3 feet apart, because we're going by the recommendations, this is just an example, and someone gets COVID, would that be considered, would we be considered immune because we were following suggested guidelines, and we were not being negligent in that? We did change our plan, but.
If that's what the CDC's guidance is individuals to maintain a distance of not less than 3 feet.
While masked.
You know, whatever their, you know, but their guidance is ABC. And we change our plan, our Safer at School plan, to be ABC. Yes, you are following the authoritative guidance from the CDC. So
See-
whatever that ABC is.
So it's, even with the masks, though, their recommendation is should, with regard to the mask. In elementary schools, students should be at least 6 feet apart. There's another place here that says that they should wear masks, but it's not mandating. It's not a elementary school students must be at least 3 feet apart. That makes a big difference. So the ultimate question then is, well, Suzanne answered it. We have that authority. We have the ultimate authority to make those decisions here at our level.
I understand. Dr. Jones.
Suzanne, I wanted to, the one thing I highlighted from that bill was heightened legal protections, and that really stood out to me, you know, if you're following what you should be following. Dr. Moore, correct me if I'm wrong, all of the lawsuits, the judge in the state, I think there were 6 or 7, was in favor of the schools, correct?
To my knowledge, the
Okay.
answer is yes.
And I think I remember saying that one of the wording was something like the keeping students and staff safe. And of course, we hear from a lot of different people, and we listen to them. And one thing I've heard consistently is, my child is back there because of your safety guidelines.
Right.
They are here because I feel safe. You know, there's many parents who can't stay home with their children. They have to work. And once they understood that we were doing our best at masking and social distancing, and of course, encouraging to wash hands was so very important. And I think every person up here wants a plan. Nobody wants to jump in this August 1st and say, we're going to do this. I'll reiterate, I don't think there should be changes through the end of the year. We've got to look at summer school to see what we can do, and then, you know, hopefully be ready to go with a plan that will keep our students safe in the fall. And, you know, my hope is that we have optional masking. But again, once we go there, it's going to be hard to pull back, and we must consistently watch what's going on in the county.
And I agree, and I, just as a straight fact, I won't bring an item to this board that hasn't been reviewed for legal sufficiency. And I cannot, in good conscience, jeopardize or expose the district to any liability. So, you know, as we do this work moving forward, as Dr. Jones said, yeah, I want the mask to be optional, but we do it in a way where we're not putting us out to, you know, risk. It is a thought-out process, considering the wide perspective that is in this community, allowing opportunities. I think one of the things, we've had so few issues, by no means am I saying that we haven't had issues, but we've had so few issues because our principals are problem solvers, and our teachers go above and beyond in identifying situations in classrooms to provide the flexibility. And that needs to be acknowledged, and we continue to do that work moving forward. But I agree with Ms. Berenborg. I think having a plan, the best defined criteria that can be available, and the truth is, that criteria may update from week to week.
That's right.
But it kind of puts a stake in the ground where it gives us a level of clarity. And we want to be consistent. One of the things that I think we can improve upon is not saying A and then learning something new and having to go to B. That was part of the frustration that the nation really faced, as well as us individually, because we made a plan and then new recommendations came in place. I think those days are kind of over with COVID, as the research is kind of not moving as rapidly as it used to be. But I think we can say, this is the stake in the ground, this is where we want to go. As Ms. Berenborg captured, it is saying, hey, you know, what's the plan to move us there?
So, Dr. Moore, you mentioned moving the date back. I had put in the action item April 27th workshop. Could we have at least a plan for summer school by then?
Yes, yes.
Because as a parent, you know, they don't like finding out things last second. I remember we changed dress code years ago, and they did it the week before school started, and it was just,
I remember that.
that was just horrendous, you know, because parents had already done all their school shopping. As a matter of fact, tax-free weekend had already come and passed. So, you know, we can't make decisions quickly. We have to make decisions with a lot of forethought, because parents are wanting this information. They want communication. They want to know way ahead of time. That way they can make a decision. If we decide to go optional masks in the fall, then the parents that don't want that can make that decision. And the parents that want that can make that decision. So I think it's only fair to parents to put this out early. I think I'll amend my item for, then I want summer school guidance for the April 27th workshop. And when are you asking for, you mentioned July, that to me is too late for deciding something in the fall.
The item says June 27th.
June?
I think that's what the item currently says, June 27th.
June, no, it says, sorry, April,
What are we looking at?
okay. So you're saying that the plan on June 22nd, okay. So the plan for next year, you're willing to have in place, I'm looking at my item for tonight, you're willing to have it in place on June 22nd. I'm asking if we can discuss it and have it moving forward. And then a final decision, you're saying, made on June 22nd?
Through the chair, my concern is June 22nd may not be late enough to have
Right.
as much information as we
Right,
need
I get that.
to make the right decision. But I agree, and that's the intent of my, you know, starting this conversation, and without a plan, you fail, is putting that information out. I think June 27th is more than appropriate for our summer programming offerings. I believe there are, you know, tweaks and modifications that we can make into that plan as we go into summer school, and then continue to update it. My desire would be by, you know, the end of the first week in July, the community has been fully informed, which is a 4-week period prior to the opening of schools,
That's way
which
too
gives us enough time to respond and act. And that's just kind of what we learned in the past. 1 week, you don't think 1 week would make a difference, but in this reality, it gives me more time to engage, because we are on the front end of having this conversation and dialogue. Every system will be having these conversations as well, so it allows us to pull upon that expertise as well.
Okay, so on my item, looking at April 27th workshop, you can give us a presentation then about summer programs
Yes.
and possibilities of, on the discussion points that I put here, possibilities on those discussion points? Okay. And then you're asking for, did I hear June 29th? What was the date?
I would say prior to the first Tuesday in July, the second Tuesday in July, which is the,
So we have one meeting in July.
I know, that's the,
May I?
Go ahead.
I think that that's still too late. We should be able to tell parents before July, at least by the end of June, what our plan is. Parents go away. A lot of parents are not receiving communications over the summer. Communications are much more difficult for that fact. You know, we don't have school, obviously. So I would prefer that we have notification even if it's a tentative notification, and then letting parents know that a final decision on this, barring no other outbreak, barring, nothing tremendous coming our way, this will be the plan, but we will absolutely, with 100% certainty, confirm it by the end of July. However, by the end of June, I think would be appropriate.
I think that's fair.
Thank you.
So which date in June are you looking at?
The item as is,
Okay.
I agree with, I'm sorry.
Oh, go ahead.
I
I'm
agree with
sorry.
Ms. Rosario. Just know this is a fluid
Yeah.
document. As she said, barring any kind of, increase in what we're dealing with in the summer. And with everybody home in the summer and they're in activities,
Yeah.
we don't know.
Can you just clarify? Mrs. Berenborg brought this up, and I had it but skipped over it on my notes. The criteria that you'll use, you mentioned legal sufficiency, obviously, so we want to be consistent with CDC guidelines, which we have been doing to date. What are the criteria? Can you just clearly articulate the criteria that you'll use in order to determine the plan and how we move forward? Given the only issue that's coming up here is optional masking or not, right? Everything else is fairly straightforward.
And the answer to your question is really to convene with the medical experts in those particular fields and lean on that expertise and that guidance. To say, school district make a plan without vetting it through multiple resources and multiple individuals who have that level of expertise would be negligent. So it is just not simply a school improvement plan or a district strategic plan. It holds the mustard or stands the test in terms of, multiple medical professionals in different arenas to say, hey, this adheres to the current guidance. And right, the guidance can change from June to July to August, but we need to be fluid enough to continue, because the guidance will become less, or the reactions to the guidance, the report, what you would have to do, would become less over time. So as that guidance is shifted or modified, we then too would shift or modify.
I'd like to add to that if I can. I don't mean to interrupt. Let's not forget the feedback from faculty, staff in a survey. I don't know if you want to make it as simple as yes or no, masks, yes or no. Parents, students.
No, and thank you, Ms. Rosario. And we will convene the task force once again. We'll replicate the process. I've made a number of offers to extend to ensure the task force has multiple points of view, both on the pro and con side of mask. I think that's going to create a very good dialogue for that problem-solving team moving forward. Local pediatricians will convene with staff and teachers as we close the year. We won't make decisions in a silo, but we'll use all of the resources that we have available to us to get as much information and data to have a deep understanding as to where faculty, staff, parents, students feel in order to make the decision that holds up to the medical guidance, while at the same time is being informed by the thoughts and opinions of our community.
I would also challenge you to also add to those professionals, not just pediatricians, but pediatric services in dental and ENT, just to get some other perspective with regard to masks around mouths, obviously.
Okay, and
Sorry,
Dr.
Dr. Schiff.
Dr. Schiff, you weren't finished, correct?
Yeah, I guess my only other point is the issue of vaccinations has come up. And I want to be clear, because I think there's confusion around this. Getting a vaccine doesn't mean you're not going to get COVID. It means you're not going to get long COVID, you're not going to be hospitalized, and you're not going to die from it. So the availability of vaccines doesn't mean that we are decreasing necessarily the possibility that people can get COVID or the transmission of the disease. It means we are decreasing the likelihood that the disease will be severe. And so when we talk about vaccines, I didn't hear Dr. Moore in any way suggest that vaccines would be mandatory for kids, for students. So I want to clarify that because that came up in your comment.
No, I asked him to clarify it.
Yeah, so that, we're not mandating it, or at least to date, we have not done that. But the availability of vaccines doesn't mean the disease goes away or people aren't going to get it. It just means we're not going to die from it. So
Like the flu.
I want to be clear. It
Like the
means the
flu.
likelihood is significantly diminished that we will experience severe, long-term harmful effects, hospitalization, or death. And I want to be clear, because I think there's constant confusion about the idea that if you get the vaccine, that means we're all immune and the disease goes away. Unfortunately, it doesn't. I wish it did. So.
Ms. Rosario?
Yes, thank you. We're still, the whole lot, the immediate concern for, not so much for the students or the staff who get COVID during testing for the rest of the year, but the quarantining of students, what's the plan for that now, moving forward for the rest of the year? I don't want to isolate kids from testing if it's not necessary.
Well, it's not a short answer. I think as Ms. Berenborg said, I don't think there needs to be any confusion out there. Schools, whether they are private, whether they are charter, whether they are public, do not quarantine children. We are not in the business of quarantining. We have no authority to quarantine. This district the school board, challenged that process in October. School board attorney and myself engaged in multiple conversations to determine if there was a legal battle that we could fight at the direction of this board through the item that Ms. Berenborg brought back in, I want to say, October. That exploration ended in the validation that it is the quarantines under the authority of the health department. So in looking at some of the numbers from charter schools, they seem to be very consistent with numbers of equivalent size within our district. So when I look at the charter high school, they have quarantines of 24, 16, 7, 17, 12. When they do a quarantine, the health department goes in with the tape measure, puts it out 6 feet, does a little circle, and if you're inside of that circle, whether you have a mask on or whether you don't have a mask on, whether you have a guard or whether you don't have the guard, quarantined, even with the 3-foot rule. And
They're still quarantining at 6 feet?
So 14 is.
Why aren't they following CDC guidelines?
That would be a conversation. That would be a conversation for them.
Just curious.
But that is in fact the reality, and the rules don't change for a public school system than they do for a smaller school. Now, other schools, we go to school 5 days a week. There are charter schools that do A and B options, which would be considered a blended option. Still, those schools have quarantines very similar to schools our size. Schools 5 days a week, schools 2 days a week. So the reality is quarantining is being equitably done across the district by the authority of who does it, which is the health department. Currently, we have 60 students who are quarantined. The length of time of quarantines has gone down drastically since the CDC and health department, following that recommendation, did make the modification to the time that a student was quarantined. As it comes to the assessment windows, first, the assessment window has been drastically expanded. So assessments take place between now all the way through the end of May. So there's a great deal of flexibility provided by the state in conducting those assessments. A little bit later in our presentation, just Friday, as I emailed the board, concessions were made under a new executive order that allowed schools and students to opt in to the grading of schools. And we need to continue to move forward in this school system to really put the child first. And Ms. Rosario is right. There were schools that are very small elementary school had 10 students quarantined. Now, I don't know what grade those students are in, but if they are in the 5th grade in a small elementary school, that school may not meet its lowest 25%, because we have schools in our district where the lowest 25%, which is 200 of a 700-point grade, is 9 students, 14 students, 17 students. That is not a true representation of what's taking place in grades K through 5. And that's part of the flexibility that the state has provided to us. So as we, are continuing to debrief what the executive order that was just released, the advice that we're giving to principals is to move forward with compassion and grace, to make sure that we're looking at, if a student was quarantined for 10 days, maybe that family makes the decision, and working with the school, we're going to take another 2 weeks before he or she is assessed. There are still going to be families in our community who don't want to return to school to take the assessment, and we don't have to feel that obligation or pressure to convince them to come in, and that is just fine. We want to test as many kids as possible. I think we'll be around 90 to 95% of our students tested. That gives us the needed data and information really to make the appropriate decisions on what has been the true impact of COVID. And there's multiple impacts of COVID, whether it be attendance, whether it be quarantines, whether it be students that went from one model to the other model. So many different variations have come into play this year. So the executive order provided by the state has given us a great deal of flexibility, and it is the right move to allow us to be adaptable in terms of how we service our community and our students.
So if I can follow up on that, what happens with the students who choose, with the parents who choose not to bring their students in for testing? Are they exempt? I mean, is that an opportunity for that child to choose to be exempt?
You opt in for the grading of the school. Our goal is to test as many kids as possible. So that remains the same. Now, if a family makes the decision just not to test because of I am in virtual or I am transitional, we've made accommodations at each of the schools to provide spaces for them to take those environments. And speaking to our principals, they feel very, very comfortable that they'll be able to hit their percentages.
Okay, can we move on to the next item?
I'm not quite done with what I was saying.
Okay.
I wanted to share here on our plan, and I know that you're going to review it, but I wanted to bring to your attention on page 18 of our plan, there is a flow chart there that shows the overview of case response, and contact tracing is a part of this. According to the new guidelines, the definition of close contact is someone who was within 6 feet of a person diagnosed with COVID for a total of 15 minutes or more for over a 24-hour period. Now, that's pretty specific. I don't know if any of our children would then qualify. If you have been around someone who tested positive for a total of 15 minutes or more, or over a 24-hour period. However, the definition of close contact also applies regardless of whether either person was wearing a mask or not. So some of these, I think, need to be, and I don't mind giving this to you, but some of these need to be considered when revising our plan and moving forward. And I'm thinking about testing period here. Last is quarantine should be used for students, teachers, and staff who might have been exposed to COVID. Close contact identified through contact tracing should quarantine unless, and there are some, this is what's new, unless they are fully vaccinated or have tested positive in the last 3 months and do not have any symptoms.
Those are your edits, right?
This is
Okay.
from the CDC.
Okay, okay,
Guidelines from the CDC.
okay, all right.
So if we do not have students who have any symptoms for the rest of the month, we'll be covered because following their guidelines, if they do not have any symptoms, we don't have to quarantine them.
Those are the updates.
Yes, sir. I will hand this over to you.
But the health department does the quarantining, so would
Correct.
they agree
Yeah,
with that?
but we have to make sure that they understand that the CDC updated their guidelines.
But that.
This helps.
I understand, but the CDC also just updated their guidelines, said 3 feet, but yet they're still quarantining at 6.
Well, this is my issue.
This is the frustration that
Yes,
we're under.
this is my
And
issue.
I think I don't think I'm going to alleviate the frustration, but in our conversations with the health department, I can give you, here is how it is being interpreted and being implemented in this particular county.
So I want to ask one last question before we move on. How many kids that have been quarantined this year do we know have gotten positive result back?
Through
I
the
know
chair,
it's probably not able to know all of them, but
there's been, that was a point of pride for us going into October, November. Since then, we've had a number of both staff and students who have,
who've
who were-
tested positive, because it was 0 for the longest
yeah,
time.
it was, and that has since changed. January and February were not kind months in terms of the COVID.
And maybe we need to look at that breakdown when you're making the decision in June of looking at by how many people, adults versus kids, because everybody's saying, kids are virus transmitters. And I know from working, with young children for years, I'd get a cold about 10 days after school started. So yeah, the common cold gets passed really easily with little kids. But we can't blame children for all virus transmissions. And I think that's the frustration, is that's what I heard at the beginning of all this. And I would like some data looking at that for us as to, prove that or not. Are kids really transmitting this, or are they not? And I know we're not the ones that are medical experts, but we do have our data, and we do have our community's data. So let's take a look at that data, because I think so many people are getting the fear factor from the news. You read the news, COVID cases are down, you get all excited, and then you hear, okay, Michigan is having a problem.
Yeah.
And it's like, okay, now we're supposed to worry again. So it is frustrating to live in these times, and I know we're not the only people that have lived in times like this. When the flu came out, the flu was the same issue, people were dying from the flu, and then, now we have the flu shot. So, and I agree that the shot doesn't take it away, but it definitely lessens the blow, and that's what the flu shot does as well. So I look forward to your presentation. I look forward to bringing this item up. Board members, I'm asking you to really look at this as a stair-stepping opening, long-term plan, not a last-minute, let's fly by the night plan. Let's really be careful with what we are looking at, because the community wants us to really communicate well, and by just sitting here and saying nothing, I don't think that's communicating well. So one way or the other, we just need to communicate it. Okay, thank you.
Thank you. And our next item is going to be presented by Dr. Packard. I will turn it over to here regarding our code of conduct and the work that we've done in preparation to bring this item to you tonight.
Hi, good morning. Thank you so much for allowing me the opportunity to talk through the work that we've done focused on the proposed school year 21-22 Code of Student Conduct. So for today, we're going to review just a timeline of the work that has been done thus far. We'll talk a bit about our advisory team members who contributed feedback. We'll review the proposed changes, and then we'll have time for questions. So our timeline. This work commenced in January 2021. We had 24 community members, half of whom were members of our SDIRC community, participate over the course of 3 team meetings. They gave excellent feedback. They had homework in between each session. They worked hard during those 2-hour sessions, and we appreciate their time, their commitment, and the opportunity to improve the code based upon their feedback. We also challenged ourselves to really elevate student voice this year. We thought it was critical, and to my knowledge, it is unprecedented. We had almost 100 students across our secondary school campuses participate in a series of 90-minute work groups with us. And so that was just an incredible opportunity to be able to hear directly from our students as members of stakeholders as we engaged in this process of revision. In February and March, our Office of Strategic Planning and Support Services teams met to really review all of that feedback, ensure it was aligned, the changes that we made with state and board policy, as well as state and federal statute. We continued to make changes throughout the month of February, and in early March, we held a virtual team meeting for those constituents who had participated as advisory team members to review the additional changes that we had made up until that point and solicit additional feedback. In April, we submitted the proposed Code of Student Conduct to you for your review. We're here today to review those changes that are proposed, and with your approval, we will move into May with a public hearing and proposed adoption for school year 21-22. So as I mentioned, we had 24 members on our advisory team, evenly split between Indian River County community members and stakeholders, as well as SDRC employed staff and faculty. For our students, we had 99, so literally just shy of 100 students. You can see the breakdown in the slides based upon participation from our different secondary schools, as I mentioned. We had a very diverse group of students, which we're proud that diverse voices, again, were elevated and represented in the feedback that we obtained and changes that we made based upon race and ethnicity, as well as disability status and economic status. Student feedback overall was quite positive, as was community feedback, both internal and external. The changes that were made for the 2021 school year were positively received. And so we really focused a bulk of our effort and discussion on increasing accessibility in terms of readability and clarity for all stakeholders. So this is an iterative process. We go through this each year. In this iteration, we've taken additional steps to ensure that the language is truly accessible by each stakeholder so that they understand the code, the purpose, and the steps that they can take to learn more information. So you're going to see updated responsibilities, very minor updated responsibilities for students, parents, and staff, including a link to a page that will be created with more information. We have added additional information for our students in transitional and virtual models. So we have highlighted when things are applicable, as well as some information that is specific to them. We really felt it was necessary to expand the corrective intervention examples, and so we have added additional resources for our students and our school teams in those areas. We created the alternative school-based program to inspire Renewed Excellence, Aspire, which is an alternative to in-school suspension. We're very excited about that. Due to Susser language changes from the Florida Department of Education, we did modify our own language to be consistent with those modifications. We streamlined wherever we could, so if there was redundancy, we attempted to correct that redundancy, to eliminate it. Again, to ensure that it was clear for all stakeholders, students, families, as well as our staff members. We added nicotine and cigarettes to our tobacco-free statement. With regard to dress code, we removed any language or examples that disproportionately were associated with different subgroups of students and individuals. We added and removed glossary terms as appropriate, and then we have added hyperlinks related to our appendices, as well as other documents and information that is pertinent to our families and our staff. Up next, once we have received board approval, we will move forward with revised training for our staff, as well as for our students and our families, and we will update our website to reflect all approved changes. And so that leads us to questions.
Okay, any questions? All right, Dr. Jones, you want to go first this time?
Thank you, Ms. Packard. I wasn't on the team last year, but I observed quite a bit, and I was really pleased with how the format changed. I think elementary, middle, and high school a little bit different, which I thought was really good for our students. The Tykes and teens, where we're looking at out-of-school suspension, Dr. Moore, if someone is sent there and they do their work, that's not counted as a suspension if they're in that program, correct?
Through the chair, yes, that is correct.
Okay. And do you know at this point how much that has reduced suspensions this year?
Suspensions are down tremendously, tremendously. When you look at that initiative, it's twofold. A, it is an alternative to suspension where
Right.
you're just not sending the student home, you're sending them to receive services and support. So the best way to evaluate the impact of that particular program is repeat offenders. So if a student did something, did we empower him with the skills or the ability to problem solve, so when that same scenario happens in the future, he now has those particular skills?
In your plan for the alternative school, I read a little bit about that with making some changes in the students. What would that look like?
As we've problem solved, there are opportunities to continue to address the maladaptive behavior while at the same time ensuring that we're continuing to provide the instructional support to students. So ensuring that the opportunities to engage in the instruction, collect the work, bring it closer to the school sites in some scenarios, do that at the school, at school sites. We believe that we could not disadvantage the child by returning to him or her class and falling behind. So not that they're not doing the academic work while at the Altos, but more times than not, it was just academic work, not 100% associated or aligned to what was going on in that particular class. So we think we can provide that connection so the students don't get behind.
And one last one, the in-school suspension, which I used to call timeout, but heard some good things about what we're doing in there. Can you be a little, looking at behavior changes and so forth, how's that going?
Through the chair, and that is, once again, another area. Timeout is what we would call as the principals, we just need to kind of check the behavior, we need to give some reinforcement, cool down, and get back in class. So really using or empowering our school counselors, our success coaches with knowing if we could provide the intervention in a small window of time and then get the child back into class where he can find success, then that's what we need to do. It doesn't need to be 3 days or 2 days or a full day in some cases. Our goal needs to be to address the behavior to ensure success while in the classroom.
That's all for now, thank you.
Mrs. Rosario?
Yes, thank you so much for presenting this. I do have an addition. On page 7, I received feedback from several parents, and it's very minimal. Under responsibility of parents/guardians, are you there? Okay. The 10th bullet down, which is actually the second bullet from the bottom, it is underlined, visit your child's school and observe in a classroom consistent with school processes and procedures. The insert would be after classroom to add and/or at extracurricular activities. So essentially, it would read, visit your child's school and observe in a classroom and/or at, extracurricular activities consistent with school processes and procedures. Thank you.
I actually have an item Dr. Moore knows about. A couple years ago, there was an actual part of this that said parents' rights. Did you find it, Dr. Moore?
Yes, I did.
Okay, what year was that?
It was 2018-19.
Okay, and in there was a section of, this is a parent's rights for when they come to school, correct?
Yes.
Yeah, and that was removed, and I'm not sure why it was removed, but understanding that there is a bill that's going through very quickly, and it's supposed to be voted on the 20th of this month, I believe, in the Senate. So if that bill goes through, which is expected to do so, we'll see, barring another issue, the Parents' Bill of Rights then would be something that I think either should be injected in here, or because we talked about the fact that this needed to be printed and out and or not printed, but posted and out for parents soon, do a second or a supplement that says these are parents' rights.
So in problem solving with you yesterday, as well as the team, there were a couple things that we problem solved around. in that previous version, what we did is shift from parental rights to responsibilities of parents and guardians, and the content is overwhelmingly the same with minor modifications for redundancies, as Dr. Packard mentioned. But I think we do have a policy that is in place and has been in place. And as the parental rights legislation works through, there's no reason for us not to reference what we currently already have and that is policy. So I would be open to adding at the last bullet, which would basically say, please reference School Board Policy 5780 for student-parent rights for additional information. And
Okay, sorry.
I have the reason I want to reference the policy, when and if that goes into law, each district in the state of Florida will be required to act.
Right.
We already have a policy that substantially meets the requirements. So we may have to, depending on where things land, make modifications or changes to the policy. But we're not changing the policy number, just the content based on whatever the law would require us to do. So this would allow us to continue with the code of conduct while at the same time referencing it, and as it goes through adoption or changes or not, it's still there in a very transparent way.
So let me talk the difference between policy and a handbook. I'm gonna tell you a story of when I was a parent, and I had an issue in high school. I believe I've told you this story, but and my child was having her grade marked down because of a health issue, and it really upset me. So I went to the teacher, and the teacher says, "My class, my rules." I went to the administrator, and I was told, "Our school, our rules." And so I had to pull out the policy book. I actually had one, and the reason why I had one is I was an assistant principal at the time in the district. Now, I knew policy, but I'm going to tell you, most parents don't. And so I was able to turn that policy book around and show them that it wasn't their school, their rules. It was the school board's policy that gave my child that permission. So, of course, her grade was put back, and I was apologized to, which I appreciated. It was furious for me at the time to have to go there, though, to a policy. And I had the same situation happen this week with a parent who called me. They were a little frustrated that they were told no with something, and then had to research the policy to be able to come back to say, here's the policy, this is what gives me this right. So, and I'm not talking about parents visiting in school, I'm talking about something else. But my point is, yes, we have policies in place, but sometimes, and I think with the Bill of Rights, this is a good opportunity for us to come up with some sort of handbook that we put on the website next to this.
Through the chair, I don't want to put Mr. Meyer on the spot, but I'm going to put Mr. Meyer on the spot because this is something that we're actively working on in order to ensure we have I'm going to call it the sister document, but maybe the sister document. So, Mr. Meyer, you want to give a brief update on that work that we're leading?
Yes, Dr. Moore, I agree, Ms. Mayor Morgan. I mean, the parent-facing handbooks are very important. I think there has to be clear alignment between the policy and those handbooks. And so what we want to do, as Dr. Moore said, ensure that once the legislation passes, that we amend both the policy and then create a standalone, comprehensive document that's easy for parents to digest and understand, that references everything clearly and concisely. I do agree with the way in which we're discussing this. I mean, we have a lot of different documents that if we were to try to include all parts of all documents in each document, we're going to end up with many documents that are 400 pages, right? So referencing within, like, let's say the student progression plan, where you would need to go to the parental Bill of Rights handbook, or referencing within the Code of Conduct where you should reference that within the Code of Conduct. It would cut down and streamline the size of those different documents, making sure that we have an appropriate parent-facing document along with official, more, no offense, Suzanne, legal words within the policy that makes everything give the power that's there. So that's what we're working on. So we're already developing in anticipation of the passage of that, just because even if it doesn't pass, there are many things listed within that I think we could create a document that would be comprehensive and a benefit to the parent. So we're working on creating one regardless.
So what I'm hearing is you're making a a parent-friendly version of the Bill of Rights and statute?
Yes.
Okay, thank you.
Thank you.
Anybody else?
Yeah, quick follow-up on that. Is there something comparable that we have or will create or anticipate for students so that the health, safety, and well-being of students is equally recognized and protected? There are some things I know we are state mandated to report, but I know there are concerns around this about also protecting the well-being of students. Do we have a student rights handbook, a way that students have a document as well to know their own rights and responsibilities for their own well-being?
I think the code of conduct.
I just remember when I was principal at Gifford Middle and Sebastian River High School, within our agendas, we put student rights and responsibility, parent rights and responsibilities. And that was a while ago, but we used to have that.
And I think the way that we've designed the code of conduct really kind of looks forward to what the responsibilities of students are, responsibilities of staff and administration. Now, one of the things to kind of ensure that there's a deep understanding by all members of that school community is really ensure how we're sharing that information with students. And I think as I reflected on our opening of schools last year, there are significant opportunities to be more intentional of how administrators are communicating the information around the code of conduct, the expectations that govern behaviors within a school. So I see significant opportunities to norm on how we do that across the district and ensure that we're not putting teachers in situations where they are the bad guys, but ultimately, you know, being more intentional around informing students of what the code of conduct is and in a way that gets buy-in and understanding versus I'm being barked at a bunch of rules in my first couple of days in school.
Right.
That's not what we want.
Yeah.
Yes, Ms. Rosario?
Whenever she's done.
Oh, Dr. Schiff, sorry.
Yeah, I'm not, yeah, I won't belabor this right now, but I want to make sure that everybody is really clear moving forward, exactly what they are required to do, what they are not required to do, you know, where their rights and obligations begin and end. And I am sure that we will have many discussions about that moving forward.
I'm sure we will too.
I would just like to add that Mrs. Dampier, myself, and Dr. Moore and Mr. Meyer have been in communication on many occasions about creating a virtual school code of conduct, essentially. There are our virtual school students are our students, and so this code of conduct would apply to them. However, there are certain behaviors that are expected, certain manners in which virtual school students, the way they communicate with each other online via Zoom or via Teams, the way that they email the teacher or how the teacher engages with the student in these chat rooms and so on and so forth. Those behaviors are in the process of being created specifically for virtual school. So we did add a bullet within the responsibilities of students that it states, in addition, online students must participate actively in class through discussions, posts, and other assignments as directed by the teacher. However, some of these online learning platforms, or the ones that we are using, are currently in the works of being created. So just wanted to share that with board members appropriately.
Thank you. I believe we're on item C.
Thank you, and
Thank you, Dr. Packer.
Thank you.
Thank you, Dr. Packer.
And at the will of the board, Ms. Berenborg, I still would like to add that statement to reference back to the policy.
Oh,
Just-
yeah.
okay.
Would that be an amendment, though?
Yes, that would be yes,
Okay,
between now and next meeting. for the next
Got it.
meeting. I just need the, okay. Dr. Packer, look at me, what in the world? And I do want to acknowledge Ms. Dampier before we finally move on to our final item. As I said, she is eager to return in good spirits and in health. She did a absolutely outstanding job, as did Dr. Packard, in putting together this presentation. This is the third quarter update that I will provide. This will go through some of the information as it relates to our strategic plan, African American Achievement Plan, as well as information requested by the Equity Committee. The Equity Committee, during its last meeting, asked us to consider the 53 recommendations that were made by the 2019 Equity Committee. Following that request, we did have a joint meeting with the NAACP, although we did not come to consensus finally on what the fifth status update would be. During that meeting, we did communicate to the NAACP that we would review those recommendations, and I want to walk through what we have done with those recommendations for you today. So I'll move relatively quickly through this presentation, highlighting some things. When you look at our strategic plan during the third quarter really is, in a lot of ways, not a dead period, but not a lot of data is coming in because it's full on teaching and learning. We had the mid-year data that was presented during the previous quarter update, so this is not as fruitful in terms of information. But we did transition back 900 students from the second semester. That moved us from the 60-odd% to the 85%. We continue to take impact reviews, both second and third round. That work is led by Mr. Meyer and his team. Looking forward to taking board members to that process next year. We did expand Tykes and Teens, and as it relates to mental health services at both Vero Beach High School, the Flick, at the Flick, and Wabasso. We continue to do amazing work with Power BI. I will be bringing a presentation to the board on how we use Power BI and data solving. We have significantly outpaced our growth in terms of using data to drive and inform instruction. It is getting a lot of attention, and I'm super excited to bring that information to you. And we continue to inform and engage, whether it be community activities and information. Stars of the Year Gala, Vero Beach High School Student Learning Center, just really trying to keep our community informed. Some more accomplishments, contacted multiple community partners to survey the preferred district communication method. That information will continue to grow, but we're making great strides, gaining a deeper understanding on how to better inform our community. Initiated a new onboarding packet for upcoming hiring season. I can tell you there was a buzz about in HR when was your hiring fair? It was Thursday. It was absolutely a team effort, district-led, principals interviewing, presentations being provided. I think the number was over 160 applied to be interviewed, advanced contracts being offered. We're making significant strides under the leadership of Ms. Hopefer. Continue to maximize our GEAR grants and completed a successful round of school choice. So we used a new model for school choice this year. That model had been completed. We're now under that second window. This ensures that we moved away from the paper process, and we have a computer-based process that we built into Focus and paid for, which ensures that services and assignments are equitably assigned. Some targets that we've accomplished. So, when you look at our annual targets, some information is beginning to roll in. As you know, the majority of the targets surround academic outcomes, but we do have some information coming in where we've hit certain targets, and we're excited about that. Early learning program, state ranking has been accomplished. Opportunities to engage our community, district activities has been accomplished. Parent accessing the Focus Parent Portal has been accomplished. That's going to really help inform our parents as to where students are in school, so we're excited about that. Compliance with our material audits, compliance with our financial audits. Looks like Mr. Fagan is doing a wonderful job this year. Initial health and safety violations, we've hit that target in compliance with the Florida Safe Schools assessment tool. So we're beginning to see information come in. Continuing to monitor in some particular areas. These are annual targets that we keep our eye on. Obviously, we always keep our eye on the academic targets. As hard as it is in the midst of COVID, our eye is on it. High school accelerated performance. This is information that's banked from the previous year. and it was very, very hard for our students or our counselors to make sure kids, our seniors, were in the appropriate courses to ensure the accelerated performance. And the truth of the reality, this is information or data that should be captured in year one when students enter ninth grade. So we have a master scheduling requirement system that ensures that this number continues to not be an issue or an area of concern. At the end of the day, we still think we're going to exceed drastically the goal that we set for ourselves. Instructional staff members with out-of-field waivers. As you may recall, we've already celebrated in two different, the last two times that information has come to the board, but we set a very, very high bar. So, you know, you saw there was courses going on this Saturday here to make sure that we hit that particular area. Representation of Hispanic instructors is a very, very big area or opportunity for improvement. We need to be a little bit more intentional in that particular area as we go into our hiring season. And schools with internal audit findings. And to be very honest with you, that's a target that we're not going to make. Those audits took place earlier in the year from the previous year. So we did see a reduction in school site audit exceptions, but Mr. Fagan is continuing to connect at principal professional developments, workshop with the bookkeepers, to ensure the appropriate systems and structures are created to ensure schools have audit-free findings. As you move to the African American Achievement Plan, I'll cover some of these areas. Receive application and magnet choice for 140 African American students, with 100% being offered magnet and choice seat. We did expand choice offering in those particular schools. Gathered feedback for secondary students from Superintendent's Advisory Council related to equitable access to extracurricular activities. That was some of the information that was shared with you all earlier last week, where our students really spoke to us in open and honest ways that we need to do a better job of ensuring access to extracurricular activities, and that's work that Mr. Seymour is engaging in. And then beginning to the establishment of Florida Future Educators of America chapter in middle schools and both high schools, really starting to grow our own in our system. And looking at some of the data that's associated with our African American Achievement Plan, you could see our baseline data for African American white disparity in classroom removals being removed, 4 times more likely to be removed from a classroom if you are an African American in comparison to a white student. Right now for quarter 3, that number is 2.19, and our target is 3. And as I look at that, the target, it's still, in a lot of ways, it's, you know, we'll hit our target, but still 2 times more likely is really a behavior that we need to continue to be aggressive in having those kinds of dialogues to ensure that that no longer is a reality. Certified instructors, right now the school year started at 9. That's a number that has historically been at for a number of years. We're at 11.4 right now. We can't claim 12 until we actually get there, but we are making significant movement. We are monitoring school by school. Mr. Bass continues to ensure that we're looking and we're being very, very strategic. We believe we're going to see significant movement in this particular area, and we believe that movement is long overdue. Our retention rate of African American teachers is down 3%. It was 100%, if you recall from the last update. Now it's at 97. That was one teacher who went in a different direction. Continue to be very concerned for the achievement gap, and we won't have this information until assessments come in. I can tell you, if you want to jump into schools, you're more than welcome to go and see the absolute hard work our principals are doing, how they're disaggregating data, how they're providing very, very explicit instruction aligned to the deficiency of children. I think we have done great work in that. But make no mistakes about it, COVID has had a significant impact. We had under 50% of our African American students in school when it opened, and today we're just at 80. So there's a significant amount of students who need us the most, who are in environments and finding success, but we would prefer to have them in brick and mortar and looking forward to welcoming them back if that's the direction in which they want to go. Still looking at the overrepresentation of African American students at the Alternative Center for Education. I am very, very proud of the work that Mr. Brown is doing, and will be rolling out some programs to extend services and support, both on to keep children from going to the Alternative Center and to ensure that they never come back in the Alternative Center. And we need to make sure that we're being equitable in that area as well. And then overrepresentation of African American students in exceptional student education. This is going to be a very solid focus for me in the coming years. We are, ESE as a whole, we're drastically overrepresented. You know, when my previous district was 9% students in the exceptional student program, here it's 16 going on 17. So there is some drastic work that needs to be done. When you're looking at the alignment between the superintendent's accountability system and our strategic plan, they are one in the same, but I just wanted to provide some just additional updates there as well. In addition to the 900 students that we push back, continue professional, the provisions of A2 acclimate and accelerate. Datacom is on here. This is a process that we use that allows the principals to sit and speak directly to me and say, if you want me to be successful, you need to give me A, B, C, and D. And over the course of the last year and a half, they're not being shy. They are stating what they need to be successful, and it's the responsibility of cabinet and myself to make sure they have what they need, really to be problem solving, and we're glad that we're able to do that. Superintendent's ESE Advisory Council, you've heard me share on multiple occasions that group of parents is actively involved providing professional developments. We meet tomorrow night, and we're looking forward to engaging in conversation and some new initiatives that we're going to be rolling out. We've established monthly progress monitoring updates to the 2018 joint plan and push that information to the Equity Committee on a monthly basis. Conduct feedback sessions with the Superintendent's Council, I've already said that. I've continued to ensure that I'm out there volunteering and connecting to our community. We all know this, but we were able to negotiate a multi-year contract with our teachers union, currently negotiating with our CWA, looking forward to having a successful negotiation period with them as well. That 3-year contract really speaks dividends to the relationship and the support and the collegiality in growing the system forward. Continue to work with the health department to ensure that we've have provided the opportunity for vaccinations. We moved extremely quickly and putting that together. I can't say we did it the fastest, but we got to be up there in terms of that level of speed in getting that done. Updates on standardized assessment. I covered some of this in our earlier presentation, but as Ms. Berenborg referenced, you know, we are in the midst of testing and will remain in testing pretty much through the rest of the school year. Mr. Meyer and team will be working as it relates to students graduating. The state is providing a little bit of flexibility for students who do not have that concordance score in either reading or writing. The district has to determine what that criteria would be if they don't have that concordance score. So we will be meeting to determine, you know, what is a fair and equitable way. We have to work with the charter school that has a graduating class as well, because it has to be basically a district plan. Information came out Friday, and Tuesday was our in-school non-timed SAT. So there were students like, do I have to take it? We're like, yes, you have to take it. That may be a part of the equation in terms of graduating students, but we're excited about that. We will be pushing out information as it relates to that emergency order. 3rd grade promotion is involved. EOC exams are involved. The grading of schools is involved. So a lot of information that provides us the flexibility at the local level to determine where and how we need to go moving forward. I mentioned that. No, sorry. Now when you look at, and this is information that I have shared with the board There were 53 recommendations, and I want to review the timeline and the work that the district has made. 53 recommendations were made by the 2019 Equity Committee. When those recommendations were made, it was in November. They were shared during a board workshop. As that information was shared, it was a very, very good, fruitful meeting in terms of the sharing of those recommendations. I think all parties left feeling encouraged. I was not the superintendent at this time. In December, the first board meeting that I attended, still not the superintendent, the then chair, Marshawn Green, addressed the board, very discouraged and upset, saying that the recommendations, the 53 recommendations that were provided, were not being acted upon or not being shared with the judge and the required joint plan or the joint notification to the courts. As they came in December, it was clear that there was a number of things that needed to be done in this particular area to move the work forward. There was no African American Achievement Plan. A clearly defined expectation by a federal court had not been in place since the development of the joint plan. That was the first step that I took to create the joint plan, to create the initial African American Achievement Plan. Worked with staff, reviewed recommendations to create that particular plan, brought it to the board, and before the COVID shutdown, we were able to get that plan approved. As you know, during that same time, we were overhauling the strategic plan. And that strategic plan is the driving document within this school system. And what we did is A, first, get the African American Achievement Plan because it is a requirement. B, do the collegial work across the system, gather the information that is needed to create a strategic plan. And the board members that were sitting at the time can recall me being intentional in saying that as we create the strategic plan, we will create a system to ensure that the African American Achievement Plan doesn't become something that sits on the shelf. That's these presentations. That's how we monitor and drive this work to ensure that we're not going over here, then going over here, and things get lost. The strategic plan, the African American Achievement Plan, supports the our strategic plan, in which we provide those updates to our board and drives our thought and decision-making process here in our school system. So what I did and provided to the district as well, attached to this item in its entirety, this is just a snippet of it, is did the intentional work of looking at the 53 recommendations and identifying where there is overlap in supporting strategy steps, whether it be in the strategic plan or in the African American Achievement Plan. As we move through mediation, there is a concern that we did not act upon those 53 recommendations, that we took them and we put them to the side and we just did not move upon them. This is the supporting documentation to say that we have honored those recommendations. Did we act on all recommendations? The answer to that question is no. Were they foundational in the development of our strategic plan? Yes. Were they foundational in the creation of the African American Achievement Plan? Yes. Is the information provided crucial for how we develop our plans moving forward? The answer to that question is yes. So my recommendation, and let me just finish with this slide. Here you see the district strategic plan, the African American Achievement Plan, the joint plan, aligned to the 53 recommendations. And you see where there is overlap. We are now entering we're entering a new equity committee. We did not have the advantage of feedback from last year's equity committee. This information is vital to the success of this district. This information is vital to the behaviors and the realignment and expectations that we need to make within the school system, really to continue to move this work forward. That is the presentation as it has been presented. My recommendation is that we have honored those 53 recommendations. We took them as recommendations, and we did the deep analysis in the creating of a district strategic plan that moves the work forward, and be very eager and excited about the next recommendations that would come forward. As you also know, in order to make this work easier for the Equity Committee, what staff has done is to break up the volumes of information. So we have the five-inch binders that everyone keeps talking about that we created over the course of an entire year last year. And as we went for the opportunity to go through or ask that Equity Committee to do it, it was daunting, and we had already kind of taken a pause because we were trying to work with the NAACP to avoid mediation. At the time that we came back together. As you know, it was a daunting task to ask anyone in a very, very short amount of time to conduct a thorough evaluation of such a high volume of work. In that reflection, we made the decision to provide information to the Equity Committee in every, basically, quarter. So we provided the work that was done between January and March. We've identified from staff, this is the work that we're doing between March and the end of the school year, aligned to the joint plan. Here are suggestions in terms of how to evaluate the artifacts that we're collecting. What this does is ensure that the staff is being intentional around that particular work, and not saying after the fact, oh, look what I did, but telling you on the front end, these are the things that we're going to do, and provide feedback as we move forward. So that information hasn't been provided because the time's not up, but I think the recommendation from the school board to the Equity Committee is if we can get that recommendation both on January as well as the end of the school year with that data, then staff can go to work and present back to the Equity Committee as well as the school board, ultimately the school board, on this is the shift in our annual targets for the upcoming school year. And right there, as clear and transparent as could be, this is the information that we received in June or July. As you know, as we open the school year, we'll open with updated annual targets. Those annual targets in our strategic plan, very, very innovative. They shift from year to year. They're not just this one 5-year target that you never look at. I will bring back to the board, here are the annual targets, which happen to be how you evaluate my continued employment as your superintendent, putting my, actions aligned, my walk with my talk, and have that information available from the Equity Committee and not have to do this a year and a half after the fact. But once again, as we're already doing, provide that information ahead of time. So that is the presentation. I also want to address, and then I will close and receive feedback, the noise and confusion, in some cases uproar, regarding the opportunity for us to seek an individual to serve as our Chief Equity and Diversity Officer. I have shared with you the structure that I wanted to move forward in this particular position. I think I jumped the gun. I should have brought it under one comprehensive reorg, and that leaves some questions out there in terms of the finances. I've said publicly and will continue to say, when we bring a comprehensive realignment, which will be a minor realignment to this district, it will be at a 2 to 3% cost savings to the overall district operation of this budget. That's saying the biggest priority in this district are students. In each and every single year that I'm here, we're going to reduce the district's budget to maximize the dollars. So not a budget cut. We're not losing any money. Matter of fact, under Mr. Fagan's leadership, we went from on the verge of financial bankruptcy and academic bankruptcy to being extremely stable. Our Fitch rating being upgraded, which isn't something that happens in the midst of a pandemic lightly. That is a major accomplishment and speaks to the validity of the work that Mr. Fagan is doing. We have received a number of applications, over 50? Over 50. I haven't reviewed them. I haven't looked at them. I had staff look at them, and I am told there are some very, very qualified individuals across the nation. Across the nation. And that is very, very exciting to hear. People are interested in putting their shoulder to the wheel here in Indian River County. I told staff that not staff, I'm sorry, Ms. Rosario. I told Ms. Rosario that I would look at the job description. And one of my areas of concern, as I shared with the board, is the qualification of educational leadership. And there were concerns that educational leadership may in fact exclude some very, very qualified individuals around the work of equity. The flip side of that is you would want somebody who really understands the structures and systems of a school system and the complexity of a school system. Staff has assured me that the candidates, they feel very, very comfortable based on the volume and level of expertise that we do have a significant pool. I am dead set on addressing diversity and equity in this system. I am dead set in ensuring that this community continues to grow and our school system continues to be a place where every single student in the school system feels embraced, feels cared for, and knows when they walk into our schools, they are welcome. I am dead set of ensuring every single student has the opportunity to maximize their full potential. And I'm sorry, there's significant work that needs to be done about assuring that we're maximizing the full potential of all children. Our offering of AP for all students needs to drastically increase. Performance needs to drastically increase. We are under the state average. We're in the bottom 50th percentile in academic reading performance. We're 57th out of 67 in middle school acceleration. I've lived here long enough to know what's wrong are those outcomes, not our teachers, not our students, not our families. But we need to uphold an expectation, come together and ensure in every facet of this system, we are ensuring that we are best by all kids. We're best by all kids. And the fact that we have pushback regarding the need, not the need not to have this position, to me fuels me as to why we do need to have this position. We absolutely need to have this position. I think I can do a better job of informing why we need this position. We will be doing a number of town hall meetings end of April and early May. The focus of those meetings is to collect feedback. It's to collect feedback on our master plan. As you know, we had that presentation. It's to get feedback on a K-8 school. What do you think? To look at some of the scenarios that you all were presented with over a month ago regarding schools that are significantly under-enrolled. We have big decisions to make as a community. I'm going to enhance that presentation now to get feedback on COVID and our masking system. The timing is perfect, and literally I just thought of that just this minute. As well as why equity is important. And it is about all students, academic performance. Then at that time, through that dialogue and conversation, maybe we do change the job description. Maybe we don't. Maybe we realign the district to address this particular work. But I will bring in very, very early, end of May, early June, a district reorganization that addresses the needs of this particular district to ensure that we are moving in the right direction. So taking the time to communicate the need to our community, receiving feedback from our community, and then taking that into consideration, not reacting right now in this particular moment, going through whatever interview process or appointment that we would do towards the end of May, bringing a complete reorganization to this district. When I say complete, I anticipate it being very, very minor to the shifts that we need to have. that allows us to move this work forward. So with that, that is my presentation, and we'll be happy to answer any questions you may have.
Okay, thank you, Dr. Moore. I'm glad you brought up the Fitch rating because I wrote that as a note that you skipped over that, and I think that's worthy of stating because I was here when we were unstable, and that was not a fun thing to go through. Board members, it's over the 2-hour mark. Are you okay because we have another meeting at 1 to keep going and take breaks as needed? I think I know how Dr. Jones feels. Are you okay with that? Or do you want to take a break?
I'd like to be able to have a break between the meetings.
Okay. My question is, do you want the break now? Or do you want to go ahead and ask questions and see if we're going to be done before?
No, if we can get done by 12:30, that gives us at least half an hour break.
Okay. Everybody fine with that? And welcome, Mr. Barefoot. All right, thank you. So who has questions?
We done?
Nobody?
Can I just, one comment, please? Make sure this thing's working. I think, Dr. Moore, you're going to address the taxpayers tomorrow at lunch. And I think, as we all well know, the primary focus seems to be around the cost to the taxpayers of a position that some feel is not necessary, or it's redundant to a current position, although the job description is certainly different. I suspect that in a polite way, you could be in for some challenges tomorrow. So I think the way you framed it for all of us tomorrow, if you frame it for that audience over there, will be helpful. And I think when you talk about equity, I think about the conversations that's on the news with the president's infrastructure bill, or at least the early. They've defined infrastructure about as broadly as you can define infrastructure. It's not just roads and bridges and tunnels, it's healthcare, it's the internet, it's on and on and on. And I think when you talk about equity in the manner in which you just did, it's a lot more than the way people now think of equity. And you get into these discussions about critical race theory, which is frankly something I never heard about until recently. But I do think that this is a great opportunity to give that same kind of broad perspective as well as focus on the dollars and cents of it, which at the end of the day, it's sort of, can you afford to do it or can you afford not to do it? And obviously, I think most of us feel the answer is we cannot afford not to move forward, but some tweaking and the feedback, I think, will be useful.
Thank you.
Okay, thank you. Dr. Shep?
Yeah, just a couple things, and not major comments for the moment. The risk ratio, going from 4-point-something to 2.19 with a target of 3.0. I recognize that it's down because of the impact of COVID and kids being out of school, and particularly which kids have been out of school. I would argue, and I'd like to suggest, our target should be 0. You know, we may not make it for a few years, but the notion that we have a target that African-American kids should be 3 times more likely and that's a good thing, I would argue that number needs to be 0.
And I think you read my face when I was sharing that, because that's the realization that I have. And we have benchmark it out, but in terms of determining targets next year, I cannot look at you and say that I disagree with anything that you're saying.
Yeah. Whether it's benchmarked out or not in terms of what we think we can achieve is not the right answer here.
No, I agree, and I am very encouraged with the progress that we have had. And there has been clearly defined systems in place in terms of modifying behaviors and providing professional development to reduce that number. It's solely it is not just solely down because there's less African American students in school. Is that a significant factor? Yes, but we've done a great deal of work, to speak about it. Like, oh my goodness, we're talking about it. Yes, we're talking about it. Yes, we monitor it. Yes, we look at what's happening and where it's happening and problem solve in order to ensure we're taking the appropriate steps. And the appropriate steps is awareness, understanding, and learning.
Within that, some feedback that I've heard, and we've talked about this, so this is not new news to you. Some of the feedback from teachers has been that while they are encouraged to write less suspensions and referrals, they're not necessarily given a viable alternative. So I know that there's work happening in the district to provide those alternatives, but I'd like to request that we get continual feedback about those, what they are, how they're going, and not just that teachers are being encouraged not to do referrals, but what they're given instead, what they're given in place of that, which evidence shows works better and is more productive and keeps kids more encouraged and enthusiastic about school. But I'd like to know more about what those are and how they're going.
And I think that'll be a presentation that I would like to bring back to the board. At our last executive, I have the opportunity to sit with the Teachers Union Executive Committee. They shared very similar concerns regarding how do we problem solve with that. So what we're bringing back, both in the Code of Conduct addresses that, the alternative to suspension at school sites is a first step in that. A little bit more consistency in terms of what we're doing from school to school, making sure our administrators are available to supervise at the appropriate times. So we're actively engaged in that conversation and identify it as an opportunity to improve and listening to our union to make significant changes to improve that.
And then my last comment for the moment, also in the interest of time. We have this tension in our reports and in the district between actions and outcomes, right? Sometimes you're asked, what are the actions you're taking towards a particular goal? You have mentioned in the past wanting to have criteria based on outcomes. In some of these reports, I'm seeing more actions than I'm seeing outcomes, and what I'd like to be able to do is track the outcomes. So if we're taking certain actions on, for example, there's this one report, the quarterly update that talks about the actions in the African American Achievement Plan. I'd like to create a structure so that we know what are the outcomes of all of these. There's some of that in the quarterly reports, but I want to be able to track it better. I want to be able to know, is this action producing this specific outcome? And in some places, I'm not seeing that. So I'd like to request that we have better tracking between the action, our intention, the action we're taking to realize that, and the outcome that we're seeing, whether we're making it or not. But that's important process information. And for me, I don't see enough of it here that I can track easily.
And I think as we go through from one year to the next in the problem solving, you're right. The shift of organizational behaviors is what has the influence on the outcome. If 2 + 2 is 4, and you don't change 2s, you got to change it to 5. You got to change what you're doing in order to ensure a different outcome. That is a lot of the foundational work that we did in this initial year. Some of the, and I'll say it again, some of the things that we're tracking are not the most important things. And we need to be, completely overhaul, be goal-oriented in defining what are the expectations. I think we do have consensus on some of the areas that we need to modify within that joint plan. The percent of hiring for teachers, I think collectively we agree that is it a shameful one at African American at each school is not that bar. That's not what we agree. It's not what the NAACP agrees. But in the plan itself, it's not specific enough. I want it to be very, very specific with goals attached to it. That is a clearest way. And the only caveat that I would give, because at the end of the day, the data tells a story. And we are in an unprecedented time where the data is going to tell a story, a very, very different story for very, very different realities for very, very different reasons. And as we walk into next year, man, we're going to be, I just choose to believe we're going to be in a very, very stable place in terms of being able to be consistent in providing academic support to children, all children, to move the needles extremely aggressively.
Dr. Jones, you had your hand up first.
I'm not sure if anyone said this, but welcome to Mr. Brownie, our equity chair. Thank you for being here. Mr. Bass, do you know How many, and I was on the virtual career fair for a couple sessions, African Americans participated in general, and were we able to offer any contracts to them?
Through the chair, I can't tell you exactly how many were involved. I can get that number, but at right now, the last check I was at, I believe we're up to 8 to 9. I know we have about 3 or 4 more that we're working through.
8 to 9 African Americans?
Yes, ma'am.
Okay, thank you. Dr. Moore, when I look at all these 53 recommendations, I always hone in on extracurricular and combining that with your advisory group last week, which was wonderful. And one young man talked about, he is one of 3 children in the same grade level, and he's in band, somebody's in sports, and it's very costly. So he suggested something with scholarships to help these families. So I hope that somehow we can do that. As a principal, I know we had more funding for extracurricular and sports, but I refuse to do pay to participate. I just refuse, because you have students not even going out because of the cost. You know, they're not even there. So that's something I want to continue, you know, to look at.
And that student was like, well, what are your plans? He was holding me accountable.
No, yeah.
He's holding you to the fire.
Good for him.
And Mr. Meyer, I know your group will have a hard task with the graduation criteria, EOC and so forth, but I just ask that you keep us updated. We have a DSEC plan in this district, and it deals with African American students only, with academic achievement, looking at ESE and discipline, recruitment of African American teachers, and that's a solid federal court mandate. Equity means more. Equity means, how are we working with our ESOL students where English is not the primary language? Are we okay there with Title IX, which Mr. Browning would always get on me if I wasn't? How are we helping our gifted? How are we helping the merit scholars that we saw so many of them at the Pride of the Tribe at Vero Beach High School? And then academic achievement in general. And I just want to comment on Dr. Schiff's comment, getting our discipline to 0. I felt pretty successful with that by hiring African American teachers. They were our models, they were our mentors, they modeled what they expected. I think of that young man out there at Gifford Middle helping all students in modeling an exemplary professional attitude, which I think is key. So sometimes we have to look at the proactive versus the reactive. So I want to stay on that. And like I said, equity is many more things.
Absolutely.
Thank you.
Ms. Rosario?
Thank you. I had a comment about one of the slides here. Let me just pull it up real quick. The slide on opportunities for monitoring and improving, it had the 3 bullets for the academic achievement, overrepresentation of African American students in alternative school in our alternative center, and the ESE and the ESE population. And it dawned on me that along with these opportunities that we are engaging in these conversations and how we can do better, I'm not sure that we are doing a really great job in connecting kids with our Treasure Coast Technical College and some of our other maybe smaller academies within the schools, and maybe those would be opportunities that are right at our fingertips that need to be advertised more, talked about more, given more to the students to choose. We have a fantastic school right in the heart of Gifford, and I don't want us to lose that opportunity.
And just to speak to that, and I think students share their voice in that same area, we are creating, not at a new cost, just a redistribution of services at each of our high school, an individual who will be the most explicit way of talking through it, the career and college counselor, 100% of their time looking at my seniors, where they're going next year, and connecting with them in 11th grade, in 10th grade, and 9th grade, and 8th grade to ensure when they become seniors, they've done that prerequisite work to get wherever it is they need to go. And you're 100% correct. The programming and services available, we're going to honor that school this evening. #1 nursing program in the state of Florida. #1. So, yeah, let's leverage that. But if we don't do a better job of informing both parents and students of the prerequisite and requirements, then we're fundamentally failing students. So this position will ensure that a typical school counselor has the opportunity to be responsive to the behavioral and academic needs of students, and this individual will be the expert at FAFSA, which is, a very, very complex, maximizing scholarships, doing financial aid, connecting them, knowing the prerequisites for each of these programs. As you said, we're also rolling out a new program, and Ms. Dampier is not here because the name escapes me, but I was walking Vero Beach Senior High School last Wednesday or Thursday, and I had the opportunity to sit in on that development with our principals were there, district staff was there, really receiving that information. It's really going to connect students to what is next for them, and that's what we're preparing them for. Not the end game is not the diploma. It is a key that opens up the pathway to where they're going next. So I agree, Ms. Rosario.
Yeah, thank you for that. I'd just like to touch a little bit also on some of the other items that fellow board members have mentioned. I fully support the work of our district moving forward and the intent and the goals that we want to reach with regard to equity and equality in our school system. There's no doubt about that. There's no doubt in my mind that any of the board members do not want that to be one of our focuses. In fact, that is one of the tenets of the target areas for our strategic plan. And it actually says equity, culture, and climate. But I think that there's a fine line between doing that work and embarking in areas that are very politically charged. In particular, what Mr. Barefoot mentioned with regards to critical race theory. I want us to be very careful that we do not enter into uncharted territory. Many people, because it is such a fairly used new term, I suppose, very general, that some people may define it one particular way, someone may define it in another particular way. In essence, it is a theory. And our governor recently mentioned that there is no room for critical race theory in our school system, specifically when he was introducing the new civics curriculum coming forward, coming ahead for us. And for those who are unsure about critical race theory, it argues that whites have been the beneficiary of our civil rights legislation, or that for some they might take it to a very extreme and say that white people should apologize for being white, and in comparison with the black experience, we need to focus on children. That's really we need to focus on children. Children, and what we wrote as target areas for our focus in our strategic plan, what we have in our academic achievement plan, what we have written down in our school code of conduct. We need to create opportunities for kids that I know that you do not disagree with. Opportunities for, as you mentioned, the reading proficiencies, the more for Treasure Coast Technical College, dual enrollment programs, academic academies. I mean, all these opportunities for kids that will benefit them, and not pit one another against with the idea of white versus black. We have many, many students in our school district, and we do have a lot of work to do with equity and equality. But I challenge you, as a schools superintendent, to be careful not to cross over those lines.
I thank you. Challenge accepted. And, want to leverage and create relationships as we met with the faith-based community, which is a very, very exciting meeting and a number of great connections and relationships made, to be the county that really engages in the conversation and dialogue and does it as a way to pull the community together.
Right.
That the public school system can be the entity that pulls a divided world or divided community together. And I know that that is a drastically large statement, but we do need to empower ourselves to take on difficult, hard topics and not to shy away from them. But at the same time, not engage in supporting way out here, way over here.
Exactly.
Right down the middle. We got it.
Okay, I have two quick questions. On page 6 of your presentation, you had a statement said high school accelerated performance, and I wrote ironically the word outcome on there, Dr. Shipp, because I agree with you that whatever outcomes you have at the time, I think should be presented to the board. So not just here's what our plan is and here's what we're going to do, because when you go to an interview, they don't want to know what you're going to do. They want to know what you've done. So same thing here. I want to know what have we done that you have. I know, granted, we don't have everything because of assessment period just starting today, but what have we done this year is an outcome.
So I think currently we're at 54%. Our expectation is we'll be right around 80%. That variance is dependent upon whether students, pass or don't pass. The number doesn't necessarily change in between. That's why, the third quarter they haven't taken exams. Courses aren't over. One of the things that we will be rolling out next year will be a dashboard that you can look at while you're on vacation or as you move throughout the year, aligned to our district strategic plan. So right now, and it'll be on our homepage for the whole world to see. Right now, the theory of action with the limited resources, the limited human capital that we have in that particular area, is to get those dashboards up and running and the individuals trained to use them to influence their decision making as close to kids as possible. But you'll see that also a dashboard around the equity agenda as well.
Okay, thank you. And then on page 8, you have down something about transportation. Department Transportation Plan for Implementation of ZPass. So question, is that like a GPS system?
Good Chair. Yes, ma'am, it's a GPS system. It's a parent portal where they'll be able to look on their phone and track their child's bus. And in conjunction with that, we are planning to install also an ID card. So you'll have a reader, swipe that card when you
Right,
get
we've
on
talked
and
about
off.
that, but
Yes.
that's definitely going to be in place then in the fall.
Yes, ma'am.
Okay, great, because I did receive a call from a parent last week about buses being late and not knowing and nobody answering the phone up here. And I called, and tell you the truth, it's hard to get a person sometimes, especially after hours, after school hours. So unless you have those magic cell phone numbers that I have. But I will say that, I do that once in a while. I'll call the district just to see if I can get through to a certain department, and I normally get just a name and their voicemail. There's a particular one in your department every time, and I know the person, so I know that she's probably where her voicemail is the one that's receiving if nobody picks up. See what I'm saying? So if we could fix that for parents, that would be helpful, because that has been an issue, an ongoing issue of parents calling and not getting through to somebody in whatever department, so. Okay, that's all I have. Is anybody else?
Yeah, can we have a presentation on what that is, ZPass, at some point? Okay.
And also, last thing, board members, Nancy wants to know if you will give her your summer calendar plan for vacation so that we can decide when we're going to meet. And teams can be updated because there are 2 meetings planned in July. I already told you I can't make one of them because I'm going to be out of town. So normally I plan on 1 meeting in July, so I was kind of surprised when I saw that second meeting. But I had already made plans. So I want to make sure that board members know to get that to Nancy. And also, just a side note, last year, and it's the time of the year right now, where we're being invited to all these fifth grade graduations and eighth grade graduations and high school graduations, and, sorry?
I was just going to say, we did pull principals, so we're putting together the opportunity so you could look at all of them and then select the ones you're going, well, through the invites.
Thank you. And the reason why I say that is because, I'd show up at an event, and 3 of us would be there, and then nobody would be at another one. So it would be nice to know if we're planning on going to those things. That way we can spread the wealth. Not that we're great to show up at things, but, if it's nice if they want a board member there, then it's nice that there's a board member there.
Yeah, I'll bring it to our next meeting. There might be opportunity to discuss it, and I would encourage some collaboration because many are on the same night. I'm not trying to extend the meeting, but one of the interesting things we learned is schools in previous years that really didn't do anything outside the confines of the school day are continuing with the drive-through graduation. So they have their in-school ceremonies that they have,
Those were awesome.
So now a lot of schools are going back to the
Tradition.
Performing Arts Center. So we're going to be busy. We're going to be busy, but it's the best time of the year.
Okay. Anybody else have anything? All right, then the vice chair adjourns the meeting at 12:36.